One. Good afternoon and welcome to the weekly COVID-19 press conference. With us today is Premier the Honorable David Burt, the Minister of Health, the Honorable Kim Wilson, Bermuda Government's Chief Medical, Dr. Ayo, Bermuda Hospitals Board Chief of Staff, Dr. Wesley Miller, sorry, Dr. Miller. We'll start with Premier, the Honorable David Burt.
Good afternoon, Bermuda. I begin this afternoon by expressing the condolences on behalf of the government to the families in our community who have suffered loss since our last press conference. We unfortunately continue to see members of our community succumb to this deadly disease, which is caused by the coronavirus, leaving more loved ones and friends to mourn. As we now see our cases continue to fall, we must not take where we have been for granted. We must always remember those who we've lost and continue to pray for those still in the hospital battling the coronavirus. We must also remember our healthcare workers, nurses, doctors, hospital staff, public health officers, and all frontline workers who worked tirelessly throughout this recent outbreak and, in fact, throughout this pandemic in service of their country. We can support them by continuing to follow the public health guidance, abiding by the regulations in place, and doing what we can to keep ourselves and each other safe as we go about our daily lives. This evening, as mentioned, we are joined by the Minister of Health, Chief Medical Officer, and the Chief of Staff of the Bermuda Hospitals Board. First, we'll hear from the Minister of Health, followed by the Chief of Staff of the Bermuda Hospitals Board, and then I will close with comments, and we will all make ourselves available for questions from members of the Minister. We begin with the country's Minister of Health. Minister Wilson.
Good afternoon, everyone. I too would like to echo the remarks of the Premier in expressing my heartfelt condolences to persons who have recently lost loved ones, family members, and friends to the coronavirus. Things are, however, getting a little better as we are making progress. We have fewer cases that are active, the hospital is less overwhelmed, and children are returning to in-school learning. Though we see our situation improving, we still have ways to go, and everyone must continue to do their part to help stop the spread of this very aggressive Delta variant so that we can end this current outbreak. We must not be complacent. We must not let our guard down, and we must do everything in our power and continue to do what we can to avoid getting infected with COVID-19. We've completed 39 full weeks of vaccination since January 11th, and Bermuda has administered a total of 88,417 vaccinations. Of the 88,417 vaccinations given as of the 9th of October, 52% are women and 48% are men. 85.2% of all residents over 65 have had at least one vaccination, and 80% are fully immunized. To date, 69.6% of the population has been vaccinated with one dose, and 67.1% of the population has been immunized, having had two doses. From the 11th of January 2021, when Bermuda's vaccine campaign started, to Epi Week 40, which ended on the 9th of October 2021, Bermuda's COVID-19 hospitalizations and deaths of vaccinated and unvaccinated persons are as follows. 292 hospitalizations, and that includes repeat admissions, of which 260 or 89% were persons who were not fully vaccinated, and 32 or 11% were fully vaccinated. Up till October 9th, Bermuda has also sadly had 79 deaths, of which 66 or 84% were not fully vaccinated, and 13 or 16% were fully vaccinated. And as I have repeatedly said, the COVID-19 vaccine is our best defense in preventing the spread of this virus. The vaccine will decrease symptoms and severe illness, and in most cases, prevent death. I encourage anyone who has decided to get vaccinated to book an appointment or walk into the KEMH vaccination center on Tuesdays and Thursdays between the hours of 4 p.m. and 8 p.m. and on Saturdays between the hours of 8 a.m. and 8 p.m. Medical doctors will be there to answer questions about COVID-19 and the vaccines. To request an appointment, click COVID-19 vaccines registration or go to on the website www.govt.bm, or you can contact the vaccine call center at 444-2498, selecting option number 2. Bermuda's COVID-19 vaccine booster program was launched last week, Saturday, October 9th, servicing local rest homes, as well as on Sunday, October 10th at KEMH for the immune-suppressed persons. KEMH will also service the immune-suppressed persons today between the hours of 8 a.m. and 8 p.m. If you have one of the following conditions, you are considered immunosuppressed, namely blood cancers, advanced HIV/AIDS, recipients of organ transplants, treatments for cancers, recipients of stem cell transplants, people born with conditions that depress their immunity, such as sickle cell disease or Down syndrome, persons that are treated with drugs that depress immunity, for example, high-dose steroids, cancer drugs, and drugs for advanced arthritis. And starting today, October 13th, a second vaccination center was launched at the National Sports Center to accelerate the booster program. The dates and hours of operation for the next 3 weeks are as follows. Wednesdays, October 13th to Friday, October 15th from 12 p.m. to 6:30 p.m. Tuesday, October 19th to Friday, October 22nd, 12 p.m. to 6:30 p.m. and Monday, October 25th to Friday, October 29th, 12 p.m. to 6:30 p.m. Those persons 65 years and over, as well as pregnant women who have had their second dose at least 6 months prior, are eligible to make their own appointments. To book your own booster appointment, please visit www.gov.bm/vaccine-booster or click the link at the top of the gov.bm that says book a booster vaccine appointment. If you do not have access to the internet or need assistance in making appointments as you were unable to self-register, please call the Vaccine Center on 444-2498, again selecting option number 2. You can also call your doctor for assistance. Your doctor has a duty to get you the help that you need and will gladly assist. The newly established antigen policy, which allows the importation of antigen tests for personal and commercial use, has had quite a bit of interest, which is a positive step in the right direction. This interest means that the public at large is willing partners in assisting in the detecting of COVID-19, which ultimately assists in keeping us all safe. I will remind the public that the purchases of antigen testing must be in accordance with the list that is published by the Bermuda Health Council for both personal and commercial purchases. The list is generated with the combined FDA and MHRA approved antigen testing. Analysis is currently taking place to determine if additional antigen testing under the remit of authorities in other jurisdictions will also be added to the list. All of the public health measures have been extended for a further 2 weeks until the 29th of October, and this includes the existing curfew. As we are aware, the U.S. has implemented a new policy that will not allow visitors to enter the United States if they are not vaccinated. There has been no developments on how those that require medical care in the United States will be treated. Therefore, I encourage those who are not vaccinated to start to consider their options if the United States determines that exemptions will not apply for unvaccinated persons with medical needs. And finally, schools will be on midterm break between October 25th and the 29th, and I want to advise the public that only camps held entirely outdoors can operate during the midterm break due to Bermuda's community transmission and our country status. No indoor camps can be offered during this school break. All outdoor camps must be registered and approved to operate per the camp guidance, which is located at www.gov.bm/camp guidance. Parents should only register their children at registered and approved camps. Unregistered and unapproved camps are unlawful and will be shut down. Please remember, we must all do our part to help to stop the spread of the coronavirus. Continue to follow public health guidance, wear your mask, practice good hand hygiene, maintain physical distancing, and download the We Health Bermuda app. Thank you.
And we'll go to Premier.
I thought that Dr. Miller was going to give comments. Is it on to me?
Yes, I do believe so, sir. Yes.
Good afternoon. I was first express condolences to the families who have lost loved ones. And although we're seeing a decline in the numbers, each death is no less painful. Fortunately, with the measures that have been taken and the cooperation of the public and increase in vaccination, we will see less of this happening over the coming days and weeks. Let me recognize the hard work that has been done by everyone, and in particular, thank the entire staff of BHB, both at King Edward Memorial and the MWI, including the group homes. They have gone over and beyond to ensure that a service that was severely stretched held up and didn't collapse. Because as we tried to get help from elsewhere, the recognition was that everywhere else needed help too. In our particular groups, I've been told that I was remiss in not giving particular recognition to housekeeping, dietary, and material management. Certainly that would have been an oversight, because I've always commended the various groups, and in particular, I've maintained that we cannot have health care without a clean and tidy environment, and certainly, or without adequate supply of food and materials. And certainly these people play a vital role. And I would not just say it's due to the physicians and the nurses, but it's certainly due to everyone. The success also is due to the assistance from the Department of Health, not only in helping us to get patients relocated to nursing homes and elsewhere so that we had capacity to deal with the surge, but also in terms of the support they provided. The private sector has also been very important in terms of our success by their generous donations, as well as the food that many companies have provided for our staff. We're now at the stage where things happen to be improving. We're seeing lower numbers in the hospital, and we're encouraged that the testing results each day show a trend towards lower numbers in the community. If I was to compare this week with last week, when we still had very high numbers in terms of admissions, over the past week, in contrast, we had 13 admissions and 13 discharges. So when we're at the even state, that's certainly better. We're hoping that we will see a situation next week where discharges will exceed admissions. We were at the stage where we had to go to disaster level 4, which is the highest level of disaster. We have reviewed the situation since then, and on Monday we decided that we were not yet at the stage where we could reduce that, because we still had an overflowing ICU, making it necessary for us to keep the satellite ICU open. The expectation, however, that if we were to continue on the current trend, we will be able to close the satellite ICU, and the main ICU would be able to accommodate all the patients. When we do get to that stage, we will change the alert level from 4 to 3, and we will keep the situation under constant review. The implications will be that once we are able to change the alert level, we will also be able to take back staff from the operating theater that we have repurposed elsewhere to offer services within the operating theater. Also, the same thing will apply to some clinic staff. It therefore means that we will be able to provide some elective surgery and some clinic services, but we're not promising that it is going to be full throttle right away. We have to go steady and slow, assessing the situation as we go along. But we're certainly trending in the right direction, and therefore in short order we'll be able to make an announcement as to when we will start elective surgery and open those clinics. In terms of the update with our staffing, we were at the point where we had in the high 80s in terms of the number of staff off. The latest figures I have would be 23 staff off, either due to COVID or to exposure. So that's really better than where we were just a few weeks ago. And it certainly gives some encouragement to that when we reopen services, we will have adequate number of staff to man these services. Notwithstanding our current challenge, I would wish to make it clear to the public that we have always been able to fully staff the emergency department, and that we are ready and willing to treat all the conditions, including the non-COVID conditions. Therefore, for people having strokes or heart attacks or serious abdominal pain or any other serious condition, please come down to the hospital, because we are capable, ready, and willing to serve you. Don't stay away. It would cause us a significant worry if people were to stay away believing that we could not offer services. We have made provisions, we are ready, and we can provide emergency services. And indeed, we have always been providing emergency services, including emergency surgery and other urgent cases. We just could not offer the routine or the electives because we had to use the staff to deal with critically ill patients. In terms of vaccination, which is really the best option that we have, we see the lines here at BHB lengthening, and that is very good. We also see within our staff that the vaccination numbers are creeping up, so that with the nursing staff, one may recall, there was a time when we were struggling to get to 50 or 51%. The latest figures show us having 77% of our nurses fully immunized, another 4% in progress. So that will take us to 81%. That's a very good figure, much better than most places, but we would still like to take that higher, and we believe it will happen because we have seen an increased commitment from our staff. Indeed, the minister made reference to the booster dose, and the clinical staff are particularly keen to have their booster dose, so there will be very good uptake on that. But apart from the clinical staff, I have met staff from all the other departments, from housekeeping, dietary, materials management, biomed, all the other areas, who have also made inquiries about them having the booster dose, and they're eager to have that. So that again is very good news, because it will put us in a place where we will have healthier workforce. And if there were to be another wave, we would have a higher proportion of people immunized, and therefore would be in an even better position to fight that. On a good news note, today as I walked around, and I made it a point to visit the intensive care unit, the atmosphere was much more relaxed. The stress and tension of the past weeks was much less. People still went about their business in a rather business-like and efficient way, but one could see that they were nowhere near as exhausted as they would have been up to a week ago. So we are moving in the right direction, and one must say thanks to everyone, including the many Bermudans who have chosen to be vaccinated, and the many who continue to follow the public health guidelines to wear their mask appropriately, not around the neck, not under the nose as a few people do, but to wear it properly over the nose, and also to follow the rules on social distancing, and very important, to wash or sanitize their hands whenever they can't wash it at every opportunity, because these measures are very effective in terms of the prevention of the spread of the coronavirus. Thank you very much.
Thank you very much, Dr. Miller, and thank you, Minister of Health, Minister Wilson, for your remarks, and for all the hard work that you and your teams, the Ministry of Health, the Office of Chief Medical Officer, and the Bermuda Hospitals Board, and at our main hospital, the King Edward Memorial Hospital, continue to do. We are grateful for the dedication to your work, and clearly grateful for the guidance that you continue to provide the country during this phase of the pandemic. It is great news the booster program is already underway, and shots are being made available for those who need them most. And I recognize that the appointment slots are filled for this Wednesday, Thursday, and Friday at the National Sports Center, but there is still availability for next week and the subsequent weeks. I'm grateful for the teams that have been able to stand up this booster program this short time. And I encourage all persons who meet the criteria outlined by the Minister of Health to register for their booster shot, to do so as soon as they can. Please support your family members who may not be as computer literate or who may not have access to the internet by assisting them with registration. Persons who are unable to register themselves online can please call the hotline, the vaccine hotline, which is 444-2498, option 2, where the team will be able to assist you in booking your appointments. It is also extremely welcome news that as of yesterday, 30 out of 36 of our public schools have reached the over 80% parental consent threshold for saliva screening. The majority of our schools are now being tested so that students can return to in-classroom learning. A number of our preschools and primary schools return at the end of next week and the beginning of this week, including Gilbert Institute, Port Royal Primary, and Purvis Primary. More schools will continue to return as the testing is done and the data is reviewed. The aim is to have as many schools back to in-classroom learning by early next week as possible. To accelerate the pre-entry testing, Perot Post Office will also be used for students that will be returning to school. Parents and staff will be contacted with the place and time to test. And once that testing data is received, they'll be contacted with the information of when their school will be scheduled to open. So please pay attention to the notifications which are sent out by your school, which will advise whether or not you were instructed to go to the Bermuda College alternatively to the borough post office. Pre-entry testing is proving useful as the Ministry of Education has identified 5 positive cases that were unknown to these persons. As a reminder, all students and staff must test negative in the pre-entry testing to return to school. Any student testing positive will not be permitted to return to the classroom and will be sent work packets to work on at home until a negative test is received after their quarantine period. Any student from a school that has reached over 80% parental consent but who's not participating in the pre-entry testing will not be allowed into the school until a negative test results is produced. These students will also be provided with work packets. It is essential for students' education and development that we get them safely back into the classrooms. I encourage all parents and staff who have not yet consented to testing to carefully reconsider, as we must make a collective effort to help students and teachers return to school and to assist parents in returning to work. I applaud students who have been working and studying at home. I know that remote schooling is difficult and it has not been easy for you, and so is being away from your friends at school, your teachers, and certainly the normal routines. Teachers, we appreciate you for your dedication to continuing to educate the students while adapting to the task of teaching remotely. Finally, thank you to the parents, in many cases who have had to balance their own jobs and workload with schoolwork and Zoom classes. My wife and I know firsthand that that is not easy. And therefore, on behalf of the government, I just wanted to share that we appreciate the patience and cooperation of our parents as we work to get all of our children back into the classroom safely. The government also continues to work to ensure that beyond the pandemic, our recovery and its pillar industries such as tourism are competitive. We must continue to provide our visitors with the experiences and hospitality that have made Bermuda a world-class destination for decades. This past year presented us with unique challenges due to the coronavirus. However, we have still achieved great things, such as the opening of St. Regis and the home porting initiative, which has seen dozens of cruise ships and thousands of visitors come to our shores. We did this by working together and making Bermuda a safe destination for tourists to visit. The government and the Bermuda Tourism Authority have already begun to strategize what the next tourism season will look like. This will mean aggressively creating marketing plans to support our on-island stakeholders and creating awareness about Bermuda as a tourist destination. New sales efforts in all of our key markets will be activated, and a new brand launch will be supported through all media channels promoting Bermuda. The Bermuda Tourism Authority will also continue to work closely with the Ministry of Transport on increasing both cruise calls and air schedules for next year, as well as process improvements for all travelers. Bermuda, we are extremely optimistic about the future of our tourism industry. The optimism will be accompanied by the necessary work to keep Bermuda competitive beyond the pandemic. We have battled this virus for 18 months. But the pandemic is not over. We must continue to take the necessary steps to protect ourselves, to protect our families, and to protect our fellow Bermudians as best as we can. As has been stated, we cannot let our guard down, and we must not become complacent, even as we see the number of positive cases and active cases decline. As the Minister of Health has announced, the curfew will be extended for a further 2 weeks in recognition of the urgent situation which still remains in the hospital. The Minister of Health and I will continue with these weekly press conferences for as long as the hospital remains at level 4. Once the hospital reverts from level 4, we will return to technical briefings by our public officers. In closing, I ask for us all to remember that we each have a role to play in getting Bermuda through this outbreak and also preventing any future outbreaks. We are beginning to see the statistics improve, but we cannot let our guard down. Always remember that behind each number is a person and a family who has been impacted by the coronavirus. I remind everyone to follow the basics of hand washing, sanitizing, physical distancing, wearing a mask, and if eligible, please register for your booster shot today. And if you haven't been vaccinated already, please speak to your doctor so that you can get the information required to do what is necessary to protect yourselves. Finally, the We Health app is still working. It is available, and it is certainly helpful to ensure, especially in workplaces, that there is not a significant level of exposure. You can be notified about your exposure. Let us all continue to work together to protect the most vulnerable, protect the hospital or healthcare system as we work to get our students back in the classroom. With that, I'm looking forward to taking any questions from members of the media.
Thank you, Premier. The first up for today is Jonathan Bell. Jonathan Bell with the Royal Gazette. Thank you, Jonathan, and you are live.
Good afternoon, everyone, and thanks so much for having us. Mr. Premier, I believe I'll start with yourself, or it might be and/or Premier or Health Minister. So we're seeing, as the term goes, this flattening of the curve that's happening, and we've heard you say, so you're going to be guided by the science in this. With the flattening of this curve, what's the science trigger, as it were, the statistical moment, if there is one, where you plan on easing off on restrictions further? Can you tell us?
Jonathan, I'm not so sure we would, and I would yield to the CMO to say that we've actually reached the flattening of the curve, but we are seeing numbers trending in the right direction. So that's certainly good news. But there are a number of indicators that we use to assist us with respect to whether or not we introduce more mitigating measures or we roll them back. Some of those things are certainly, first and foremost, the healthcare system. We do not want our healthcare system to be overwhelmed. And that's not just the hospital, that's the testing facilities, the laboratory that's analyzing the testing, all of our healthcare system, right? It includes the nursing homes and the like. Other factors that are used as indicators are our positivity rate, our real-time reproduction number, our mortality rate. There's 8 indicators that we look at that will help assist the policymakers as it relates to rolling back and or implementing further mitigating measures.
Thank you for that.
You're welcome.
I guess number 2 would be for yourself, Mr. Premier. So basically, the British government has come out with a report on how it's dealt with this, how it's dealt with the COVID pandemic. Is there any thought within your administration on having an inquiry that's looking at how our different authorities have responded to the pandemic, identify best practices, mistakes, and solutions? So is there any talk that you can tell us about of doing that kind of report for ourselves?
Thank you, Jonathan. I can say that I am vaguely familiar with what you referenced. I think I saw a headline on it, but I didn't read the details. What I can state from my position here, and it's also a conversation I've had with the Speaker of the House, I believe that the best place for those things to take place would be in a committee of the Parliament. One of the things in which we stated that we wanted to make sure that we set up when we became elected were for there to be permanent oversight committees in the House of Assembly. I know that those are things that were written into our standing orders. So the Speaker of the House and I are working to make sure that those things can become a reality, and I believe that's the best place for those type of things to be examined. I think that it's helpful in a democracy that we have the executive, which is the cabinet, but we also have the legislature, and the job of the legislature is always to scrutinize the work from the executive. And I'm certain that there are the opportunity to certainly look at what we've done and for recommendations on how we can approach things in the future. So I think that's the appropriate place. I certainly would not be opposed to that in any circumstance. I've spoken to the Speaker of the House, and it's my expectation that in the next session of Parliament we'll be able to have those committees up and running, and the committee that has responsibility for health or other matters to go ahead and take a look at it, because I think that it is always vital that we review the work of which we've done and accept recommendations on ways to improve. Because as we go forward, there's going to be a transition phase. We've seen that transition that is happening in a lot of various countries. So certainly there is what has taken place in the acute phase of the pandemic, but it's also what's going to take place when the virus, when we transition to more of a pandemic phase to an endemic phase. The best way to get there, of course, is through vaccination and to make sure to continue to increase that number. But from the perspective of us, we now have to make sure that we shift, because it's vital that Bermuda learns to adjust with living with the coronavirus. And so I think that there are a number of things that we can look at and recommendations which may be able to be made by members of the legislature in that regard. And I think that's the most appropriate place for that to happen. I don't know what happened in the UK, if that was from the legislature or somewhere else, but I think that's the best place for that to happen here.
Yeah, it was just something that I'd seen. Thanks. I guess number 3 for me for now would be to do with rapid antigen tests. I'm hearing from some folks that there are concerns over business travel. Is there any discussion? Is there scope for rapid antigen tests at the airport? So if I come in and I'm on a business trip and I get my all clear, I can go right about my business rather than wait?
Jonathan, I just want to make sure I'm clear. When you speak about the antigen test, because there's a number of things that you spoke, are you saying insofar as entering into Bermuda or exiting Bermuda?
I would say coming into Bermuda, rapid
Okay.
antigen testing.
Okay.
You know, I'm on a business here for business, and I want to get going fast.
Okay, certainly. 2 things. There's 2 mechanisms that I want to use to illustrate how best to answer that. First of all, the gold standard for entering our border is using the PCR, right? That's our very first border and point of protection. So there is no consideration for changing the testing regime when you enter Bermuda. You must have the PCR, which is the gold standard. That's the best way that we can try to keep COVID out and minimize the impact of COVID entering Bermuda by having the best thing at our border. So our border protection for entering would be the PCR. However, what we are looking at, and I'll address the antigen part in a second, what we are looking at is, and we're in discussions now with the Chamber of Commerce with respect to having a facility where persons, particularly the business traveler that wants to come here and do 24 hours, et cetera, move out, have the ability for them to take the PCR, would not be an antigen test, and that PCR would be fast-tracked insofar as the results, so that they can get on their way and engage in the business to which they came to Bermuda for. It will be a cost for that particular endeavor, but those are final. We're just in the discussions of that now. The second question, as you relate with respect to the antigen, you would heard that the antigen testing is being made available in Bermuda. There's a number of suppliers that are supplying the antigen testing. My statement spoke to it because we do want to make sure that whatever antigen testing are used in Bermuda are the ones that are recognized by international regulatory bodies, because there are a lot of fake ones on the island. There's a lot of fake ones being generated, everywhere. Exactly. But that's with respect to the antigen testing. So coming into Bermuda will always be the PCR. We are looking, like I said, to have a more rapid analysis of the PCR for those particular business persons that you spoke about that are here for a quick turnaround trip. And then with respect to the antigen testing, persons that want to know whether or not the antigen tests that they're using or being imported, they can look at the Bermuda Health Council, their website, which has the recognized antigen testing, and they review that regularly to add to it as further jurisdictions approve the particular use. But what we don't want is a lot of fake tests out there, and there are hundreds that are being created throughout the world that don't do what they claim to do, say they do.
Will the fast PCR, is that likely to be soon? Are you able to say?
I'm not, but we are working on it because we recognize that the business community is clamoring at the bit, so to speak. So we are certainly working as expeditiously as we can in the midst of an outbreak with finite persons to address those needs.
Well, thank you.
Thank you, Jonathan.
Thanks, Ms. Evans.
We will have Don Burgess. Don Burgess representing Bermuda Broadcasting Company. Don, you're live. Don?
Okay, sorry. I
Okay.
saw Jonathan still sitting there.
Yeah, I'm trying to get off.
All right, good evening. Health Minister or CMO, do you know how many people were in the largest cluster in this wave, and what do you know about how it started and what the impact was in terms of maybe hospitalizations and deaths?
Don, the fact that you spoke about a cluster is really important because you'll note that we last started reporting clusters several weeks ago when we moved into community transmission. And the whole definition of community transmission is when you have a number of cases that you're unable to find the index case and or the cluster where that cases became. We can't go back to where the origin is, and that's what community transmission is. So we would have come out of the cluster stages quite some time ago and entered the community transmission, which again is says that we are unable to find the link of these cases to a particular cluster. So we wouldn't really be able to have any type of accurate information concerning that because we are in community transmission and have been so for many, many weeks.
Okay, thank you. Mr. Premier, over the past month and a half, we've seen just what living with the coronavirus looks like for people with chronic underlying conditions such as diabetes, and a population that's still 20% below herd immunity for the Delta variant through vaccination. We've seen some COVID-related illnesses and death, more COVID-related illnesses and death than ever in vaccination. So if we see the numbers rise again, will you take a different approach, such as tighter border controls or some other measure? Or are we now at the point where counting illness and death is an inevitable cost of keeping the economy open and ticking?
Thank you, Don. I don't look to frame it in those terms because I don't think that's the accurate way. The fact is that a country is required to function. It's not just economy versus pandemic. The fact is that people die from hunger as well. People die from lots of different things, and those can cause ailments. I remember the former CMO said that poverty is a public health issue as well, and that is the case. And so what the perspective of the government of Bermuda is to make the best decisions, recognizing the situation that we have at hand. The perspective of which the government has taken is that the government, unlike in many other countries, has given everyone and availed everyone themselves the opportunity to minimize their risk of serious hospitalization and death in the case of contracting a coronavirus infection, to minimize the chance that that coronavirus infection will progress to coronavirus disease or serious disease, which will require you to be hospitalized, or if it progresses even to the ICU, or unfortunately to succumb to the disease that's caused. And so from that perspective, the view that we must take and the view that other countries have taken is that we have to move past and get on with our lives. Now, does that mean that every single person should go and run around and do certain things? No. Individuals can judge for themselves what, and that is the reason why from August and September till now, we stress the matter of personal responsibility, and it is important. There are some persons who are immunocompromised who, since March, haven't been going out much. There are persons who have no immunocompromisation issues whatsoever, are fully vaccinated, and still don't want to go out that much. So it is up to the individuals, the perspective of which I think has to be adopted by the government of Bermuda, and the perspective of which is necessary is that we have to make sure that we have a country that operates. It's not an economy per se. It is the country. It is the issue of, being able to go to school, being able to, celebrate achievements, being able to enjoy sports, being able to have recreation, well-balanced life, and all those type of things which are necessary. So we put the guidelines in place, and we expect people to live by them. I would disagree with your thing about saying that the vaccination numbers have not moved, because they have. They have significantly moved. And now we're at the place where almost 70% of the population has had at least one dose. So that number continues to increase. And we've seen the number of persons who continue to register for vaccination. So that number is moving, and we will continue upon that number. But when you talk about whether or not we're going to do something different, I think the approach has to recognize that there will be coronavirus infections for the foreseeable future, at least for the next 18 months that we're considering. And so from that perspective, we cannot continue to have heavy restrictions. It is just not feasible. There is not an issue when it comes, I guess I would say, when you speak about from the border perspective. No, our economy and our people have to survive. And so from that perspective, I don't view it as, health versus economy. I view it as the totality of society and the things of which normal human beings want to do and enjoy. People want to see their families, people want to see their friends, people want to engage in activities, and individuals can judge the risk for themselves. If you have elected to, if there's no medical circumstance prevents it, if you have elected to not get vaccinated, you have elected to have a higher risk of serious illness, or that's the choice of which you've made. And in cases where it's the government's perspective, the government cannot choose for other persons, but the government has to make sure that we set out inside of the country the fact that these are the risks that you have, these are the ways to protect the risks, and it's for individuals to make the choices on those risks. Our job is to make sure we do what's necessary to protect the healthcare system, because what we don't want from a pandemic is what we've seen for the past few weeks, of course, is where medical issues may have to be delayed due to the fact that the hospital's capacity to keep up with persons who may have serious coronavirus disease and are taking up resources at the hospital.
Okay, thank you. CMO or Dr. Miller, in this wave, there seems to be quite a few people who were vaccinated who passed on, still at a lesser rate than the unvaccinated, but still did not survive getting COVID. In specific, the number of vaccinated deaths were 12% to August 18th, and from August 18th until now, it was 18%, and there's a similar rise in vaccinated people going to the hospital. Can you explain what factors have led to this rise in vaccinated people going to the hospital and passing on?
Hi, Don. I think I'll take that. Yeah, interesting observations. Actually, it's 16% of deaths so far, since vaccines have been available, that have been associated with people who've been vaccinated. The specific instances around these cases cannot be shared for confidentiality reasons. It will be left to the families to disclose this if they choose to. But I think it's safe to say that people who are dying, who are vaccinated, are older and sicker. Last time I was here, I presented and showed the graph on what vaccines do to modify your risks of serious disease and death to coronavirus. So the example I gave was that if you're 80 years old, being fully vaccinated modifies your risk and reduces your risk, for example, to about a 50-year-old who does not have any comorbidities. Unfortunately, the people we're seeing who've died are either have serious organ compromise and were already teetering at the because of their organ failure, and or people who are not being able to mount adequate immune response to vaccinations. And that's what we have seen as a rule so far. But again, the specifics will have to depend on the families sharing that information. But I think what we can summarize is that the people who have been vaccinated and died from this disease are older, very sick patients.
All right, thank you very much.
All right, thank you, Don. Next, we have Trevor Lindsay from TNN. Trevor Lindsay. Trevor, you.
Yep, good afternoon. My first question, Premier Burt. Can you hear me?
We hear you.
Okay, my first question, Premier Burt, why did government not provide the public school system with SCARS COVID antigen rapid tests as the private schools did, which would have aided in providing any further disruption of our public school system?
Trevor, I'm not entirely certain what you're getting at. We are testing all students to go back into school, and we have a regular saliva screening program that will commence in our schools as soon as they go back in. And we believe what we have there is sufficient, and as the Minister of Education has stated in his public statements, if there's further augmentation to make to that, then we will continue to augment there. But what we believe that we have is fine for purpose right now, and if there's any changes, those changes will be announced. But we to test all students before they are going back to school, and there's regular testing and screening that takes place in schools. And if we feel that we have to augment it further, we may do so.
Thank you. My next question, and this is coming from some teachers that are about to, teachers and students that are about to go back to school. And the questions are, why students and teachers are being asked to test Thursday and Friday, but don't return to school to next week, which would be a 5-day gap, and government tests are only valid for 3 days. Why are teachers and students being put at risk when they could have just tested next week, Tuesday, after the holiday?
What I will say is that we test all persons before they go back to school to make sure that they are free and clear to go back into school. And that is the process laid out. I think the Ministry of Education, work with the Ministry of Health and the Molecular Diagnostic Laboratory are doing an excellent job in making sure that we get this done. And what I would say is that I think that most parents and are pleased that schools will be reopening for students, and most teachers are pleased as well. Trevor, I will never profess to say that out of the 5,000 children that we have in public school students and all the parents of those persons, that they will agree with every single decision that is being made by the government. And I recognize that some persons will want to poke holes and try to challenge matters that are done. We accept those in the spirit of which they're given, but what we are doing is making sure that we can return persons to school as safely as possible. We've set out a very strong measure that there is no return to school without negative tests, and we are continuing to work that process. And I want to thank the parents, the teachers, and all those who are cooperating in this process to get our students back into school.
Thank you, Premier. My third question, I guess, is to you as an economic question. How does Bermuda plan to deal with the introduction of the so-called global minimum tax, and that threatens to threatens the impact, and this will threaten the impact of the island's economy?
I'm not entirely certain that I will agree with the statement of which you said threaten the impact or whatever of the island's economy. I think that these things need to be understood for what they are. Bermuda has always kept up with global tax agreements, will continue to keep with the global tax agreements. I believe the Minister of Finance is holding a press conference tomorrow where those questions will be posed directly to him on this and other topics.
Thank you, sir. I'll wait for my fourth question.
Thank you, Trevor. Earl, are you there?
I am here.
Okay, great. Go ahead.
Can you hear me?
Yep, we can hear you. Go ahead.
Okay. Well, good afternoon. Premier, last week you indicated that football will be given the green light to resume on October 23rd. This left many other sports in limbo, confused as they will be as to when they will commence. Can you clear some of this up?
I can't speak to that specifically, but I'm certain that if the Minister of Youth, Culture, and Sport communicated that to football, it will be communicated to other sports. And I also believe that a release went out for the Ministry of Sport talking about for all sports in regards to the return of phases which are in effect. So I believe that release was sent out by the Ministry of Youth, Culture, and Sport. I don't have it in front of me right now, but I believe that that was sent to all persons so people would be clear as to the direction of where sports are.
Okay. Prior to this return of sports phases, athletes were required to have a saliva test performed once a month. This time around, a fee to have testing done is being put on sports like nothing else in the community. This, I believe, is sending the wrong message about sports and healthy living. What would you say?
I can't say that I agree or disagree with what they're saying. I'm not familiar with the specifics. I'm welcome for you to address those specific questions to the Minister of Youth, Culture, and Sport, certainly. But I think the Minister of Youth, Culture, and Sport, as the government, recognizes, I've given in previous statements, that the totality of our life is important. And though there is a pandemic, we have to make sure that we make accommodations for all things in our life. Our numbers are what they are, but what we don't want to do is to do anything that is going to cause us to put our hospital under stress and strain again, given the specifically, I would say, contagious and certainly, as we've experienced, deadly nature of the Delta variant. So I think that the restrictions which have been put in place are appropriate, and they will certainly be adjusted, but I think that they will allow for sport to return. And I would certainly welcome you to follow up with the Minister of Youth, Culture, and Sport to discuss these issues more specifically.
Okay, my final question to you, sir. On Monday, Bermuda turned out to welcome home our gold medalist, Flora Duffy. You and your ministers hosted what turned out to be a party-like atmosphere at the Cabinet grounds. What would you tell the country about the mistakes made with the amount of people that congregated and possibly a potential super spreader event?
Well, I would hope that it was not a super spreader event. I'm grateful that everyone was wearing their masks, and I'm grateful that people were following the public health guidelines. And so from that case and instance, I'm happy that people were able to come out and support Flora's return. And it was a wonderful, wonderful, wonderful return indeed. And as long as we do what's necessary, continue to wear our masks, maintain our distance, and make sure we sanitize our hands, we should be okay in stopping the spread of the Delta variant.
As you looked out, you saw people spread out?
Yes.
Okay, all right. That's my question. Thank you.
Thank you, Earl from Island Stats. We will now take next round of questions, and this time we'll have Jonathan Bell from the World Gazette. Jonathan, please ask your fourth question.
Me again, and thank you. Mr. Premier, I wonder if you could tell us, has there been any estimate that has been given on the economic toll to what our economy has sustained during this fourth outbreak? Do we have any guesstimates there that you can share with us?
I don't think that there's been an assessment, and I don't think that we would have that information. I think that we can recognize that I can speak from my hat as the Minister of Responsible Tourism. I do know that certainly hotels did see missed bookings and bookings that did cancel without question. The World Triathlon event that was to be held here and some others, but in some cases these things were postponed and moved to a later point in time. So it's not complete economic loss, but it is delayed economic loss. And in other cases and instances, those things would be.
Yeah, I'm ready.
Sorry.
And in some cases, those losses would be permanent. But I think what's most important is that we recognize that certainly we did not want as deadly a wave as this, which caused the challenges which it had for our healthcare system and certainly for so many families. And I think that that's just an important lesson to learn and understand, is that we press forward as we continue to live with this virus, of the need to continue to make sure that we remain vigilant in all cases, aspects, and instances. But there hasn't been any particular assessment. I know the Minister of Finance, who is having a press conference tomorrow, can speak to other specific matters related to finance, and I'm sure that he'll be able to answer that question better. But we've seen some challenges to the tourism fund, and what we have to do is make sure that what we have to do is to make sure that we make the adjustments to continue to market the country into the future and make Bermuda continue to be a safe destination for tourists, a safe destination for business travel, and a safe destination to hold events. We want people to be back out, to return back certainly to stores, to continue to support local businesses as we've done throughout this pandemic, as we've seen retail sales numbers rise and continue on. And we want more people to continue to do what is necessary to support our local businesses, to support our local economy. And we think that's what's necessary and essential for Bermuda to continue. So there are ups and downs of the pandemic. Certainly there are persons who do work from home, do certainly spend less money on services. And we've seen that happen in many cases, where less money spent on services and more money spent on goods. And then we want to see the transition, because the service portion of our economy is vital, and it's a vital employer. We want more and more persons to make sure to continue using those services. So I think what we have is a balance. There are certainly places that are challenged, but I think the Minister of Finance will be able to certainly speak to more of those items tomorrow specifically. But as to an actual economic impact, that has been done regarding this particular outbreak, not at this time.
Got it. Is that it from me, or am I allowed to continue?
We're short.
You can go with one more. Go ahead.
One more.
Yes,
Okay.
go ahead, Jonathan.
Just quickly, you know, it occurs to me students are going to be coming back home soon from overseas. Is there anything we have, are we looking at how we're going to minimize the spread of variants? Is there anything specific dealing with those students that will be coming back from overseas?
I don't believe there's an actual plan for there to be supervised quarantine to be reintroduced. The measures at the border, which we have right now regarding persons who would be unimmunized, would certainly be braceted and required to have their checks, and that applies to anyone who's entering the country who is non-immunized. But the surveillance is working and will continue to work, and will continue to maintain that particular balance. And we would hope and expect, I know that many students any student returning from Canada would be immunized, as that's a requirement there. And we know that many students who are returning from the United States would also be immunized as well. Not so certain about the United Kingdom, but as rules change, I mean, anyone who is in school in the United States who's returning back to Bermuda who wishes to go back to school for the holidays would be challenged, as by then the rules will be in place in the United States that you cannot return back to the country or travel to the country by air if you are not immunized. So as the Minister of Health said in her comments, we want persons to be aware of what exists and to make sure that you do what is necessary. And the last thing I'd want, is for students to come home from the United States and for that to be a point in time where we have run low on our vaccine supply because, we're reliant on the United Kingdom. We know there was a point in time earlier this month before new vaccines were given that we are running low on our vaccine supply. And I think that it's important that persons plan ahead. There's a lot of people who like to travel for many different reasons around the holidays. And if you are not immunized, you plan on going to Florida, where a lot of Bermudians go to, you're not going to be able to board that flight if you have not taken the protection. So I urge persons not to wait until the last minute and to go ahead and to speak to your doctor and to find out if vaccination is right for you, because the rules around the world are changing and they will continue to, I think, change as there is further and further access to vaccines. I think the total of there's more than 3 billion vaccine doses that have been administered in the world, and they'll continue. And hopefully that will begin to lead to the end of this coronavirus pandemic.
So thanks.
Thank you, Jonathan.
Thank you, Jonathan. We're now going to hear from, get a final question from Don Burgess. Don, you still there?
They'll continue, and hopefully that
Don?
Good afternoon again. Sorry, let me put my camera on. Thank you. Health Minister or the CMO, how is government keeping track of long COVID? And if government isn't keeping track, why aren't we tracking this data? And since I got two questions, I'll just tie this all in. What do we know about it? What do we know about long COVID, particularly in Bermuda? How long it lasts and what are the symptoms?
Hi, Don. Well, I think the first thing to say is that there is not a agreed definition of what is long COVID. So different people would have different ways of referring to long COVID, and that's the fundamental problem. So the second part is that we don't have a chronic disease register in Bermuda. That doesn't exist. So it's just something that we're working on at the moment, and hopefully that should be part of the legacy. We'll get out of this pandemic. So having said those two, WHO has only very recently provided a case definition for a post-COVID syndrome, and that's happened within the last week. So now that we have a definition, it's probably likely going to make it onto the ICD codes. We understand what exactly we're doing. There's a clearer framework for collecting that information. So that's going to be something that will develop over time. But it's also important that I emphasize that even in that definition, there's an acknowledgement that there is likely to be changes over time and that symptoms may fluctuate over time. So that is important to measure. But having said that though, my colleague, Mike Ashton in the hospital has been interested in this for quite a while, and many GPs have been providing that information to him. That's not a comprehensive surveillance system. This is because he's interested in that and has been collating that and he's been working on that for a while. So, and I know I have talked about this in the past. Things haven't changed on. The only thing that has changed is we now have a post-COVID syndrome as defined by WHO. Thank you.
All right, thank you. You all have a good evening.
Thank you, Don. And finally, we'll go to Trevor Lindsay. Trevor, are you there?
Yes, I am here. Can I stop my video for some reason? Please forgive me for my audio coming over the air. My mic being open, please forgive me to the moderator and to the public. My final question, Premier Burt, last week I asked you about an update on the Fairmont Southampton. You said there was none. A few days later, the RG put a report out on GenCom and their challenges with the facility. As a matter of fact, our largest facility, hotel facility in Bermuda. Have you spoken, Premier, my question, have you spoken with management of GenCom about their future in Bermuda? If you have, what was the outcome? If you haven't, why not?
We haven't spoken this week since the last press conference. No, we haven't. Will we be meeting in the future? Absolutely will. I don't believe that anything that was reported in the Royal Gazette was unknown. They repeated the facts, and the facts remain, as my statement is there, that we continue to work with the company, with the hopes of making sure that we can finalize something to get the construction project restarted. And I'm just going to say it at a very basic level, and I think it's important for people to hear that this country has a very good Minister of Finance and a Minister of Finance who understands finance. And what this government is not going to do is to leave subsequent governments or subsequent persons in the mess that was left for this government. What we have seen is a $180 million bill to the taxpayers for Morgan's Point for a development that was not properly thought out and had the backing of all the taxpayers of this country. Can you just imagine right now what $180 million could do inside of this community? Could you imagine of what public services could have been supported, how we could have supported our health services, support our seniors, support our students? But no, due to the decisions of the former government, that money had to be borrowed and was not able to be used. We were paying interest on that money. We also see the fact of another project that was not supported by this party when we were in opposition, the airport project. And now we've seen a pandemic with a contract that cannot be reviewed with significant millions of dollars that is having to go to pay an airport guarantee for which we did not agree to and sign up for. Yet we have to make sure we carry it out. And so what this Minister of Finance is doing and what this government is doing is being responsible with the country's affairs. And we are going to make sure we have our due diligence, because whereas the country is required to make sure that we sign up to things, we are going to make sure that we are not putting the future of the country in risk, the taxpayers of this country at risk. And unlike the former government, we're going to make sure that we review these items very detailed and very carefully. So from that perspective, the message remains the same, that the government continues to work with the developers, with the owners of the Fairmont Southampton to get us to a place where the redevelopment can happen and the hotel can reopen. Without question, that is an aim, that is an objective, but what we will not do is repeat the mistakes of the past and put this country's finance at risk. That is not our aim and objective, and that is not what this government will be known for.
Can I have a supplementary to this same statement? Are you concerned, Premier, that we have two of our largest hotel products, which is the Alba Beach and the Fairmont Southampton, that have serious challenges right now? Are you over concerned or concerned about the issues at hand?
I would be concerned if I did not know that there was additional tourist investment an investment that's coming to the country. So at the same point in time, there are some properties that have closed. At the same point in time, there are properties that have opened, an investment that is continuing. So from that perspective, the situation remains dynamic. Do I want Fairmount Southampton open? Absolutely. Do I want the redevelopment project to happen there? Absolutely. Is the government working with the developers to make sure it happens? Absolutely. Do we think that it is important to our tourism future? Without question. But what is important also is we are not going to repeat mistakes which may have been made. That is not to say that that is what's going to take place there. I think that the company that is there has a good track record in Bermuda. You've seen what they've done at Tucker's Point. I have no doubt of what they'll be able to do at the Fairmont Southampton. But when we're talking about a very massive deal, there is time to make sure that we dot all the I's and cross all the T's. And nobody, promise you this, nobody wants that project to be able to kick off more than the minister responsible for tourism in this country and the premier of this country. And so we're going to continue to work to make sure that that happens and continue to support tourism development and tourism investment into this country as it is vital and essential for the country's future.
Thank you much.
Thank you.
Thank you, Trevor. And we will, Premier will take you as having your final remarks to close
Thank you.
the press conference.
Thank you. I want to thank the Minister of Health again. Thank the Chief Medical Officer. Thank the Chief of South Bermuda's Hospitals Board for participating. I sincerely hope that we will be able to be in a better position shortly at the hospital, but I want to just thank all the members of the public for their continued cooperation, and I want to remind all persons to please observe and follow public health guidelines. Please continue to listen to the advice that is being given by the government in these cases instances, because what we do not want to see is to see our numbers tick back up. We are moving in the right direction, and it is vital and important that all persons continue to observe the precautions which are put in place so that we can continue to remain safe in this country. I look forward to students returning back to school. I want to thank teachers again for their cooperation, thank parents again for their cooperation, and I sincerely hope that all persons will have a safe and enjoyable holiday this Monday to celebrate our gold medal winning Miss Flora Duffy. So with that, I want to say thank you, Bermuda, and good night.